Good evening and welcome to Primetime Lawmakers for February 7th, 2011, the 11th legislative day of the 2011 session of the Georgia General Assembly. I'm Scott Slade. Coming up in tonight's program, a bill to crack down on Medicaid fraud is introduced in the Senate. Democrats respond to new reapportionment procedures. Public hearings commence on SB 40, this Sunday sales bill. We continue our leadership interview series tonight. House Minority Whip Carolyn Hughley. And I'll be joined in studio for a child welfare discussion by Representative Mary Margaret Oliver, child welfare advocate, and Kristen Widner of the Barton Child Law and Policy Clinic. We're going to talk about drugging foster children. All that and more is coming up tonight on Primetime Lawmakers. But first, Senate legislation aimed at cracking down on Medicaid fraud could have clinics fingerprinting their patients. Mwandi Lawson is live at the Capitol with that story. Good evening, Mwandi.
Good evening, Scott. Two freshman legislators, Senator John Albers and William Ligon, introduced a bill today which would require Medicaid patients to carry what they call a smart card. Patient information and a digital photo would be embedded on a microchip in the card to prevent patients from sharing cards. The measure also keeps providers from billing for services they have not performed, the bill sponsors say, because patients would be fingerprinted before and after an exam.
The first part of that will be introduction of a smart card for Medicaid. Medicaid patients today already have a card, and they're used to having a card. This integrates a computer chip into the card. On that chip will be information about the patient, including a digital photograph, which will be one means of what's called multi-factor authentication. Another thing they'll have to do when they get to the doctor's office is submit their fingerprint, which will then go off of a state database which is separate from the card. Using these two mechanisms, we will assure that the person who is there to get the services is the actual person.
The other issue is phantom billing, when the card is swiped and the patient was actually not seen. If they give their fingerprint, they go see the provider, come back out from seeing the provider, re-fingerprint. We know there's a lapse of time that some procedure should have taken place, and we can authenticate that billing. There's also a need to make sure that folks are not doctor shopping, just going from one doctor to another trying to accumulate a certain type of drug. So we could follow that to make sure that didn't happen. Lots of fraud in the system. This is a great effort on behalf of these freshmen to clean up this. And I think Senator Albers said it's best. The people that it really helps are as we are in a number of years of budget crisis. We have the federal government telling us that this population is going to expand. We need to be taking care of only those people who legitimately are eligible for Medicaid and not folks who are not.
Now, if adopted, it's estimated that the program will cost $26 million to implement, plus a charge for each card issued. Bill sponsors say this is a fraction of the cost of Medicaid fraud in the state, which they believe could increase as more Georgians qualify for Medicaid through the federal health care program. Well, in this letter to the Speaker of the House and the Senate President Pro Tem, Senate Democrats today voiced their opposition to the creation of a legislative and congressional reapportionment office, which would replace the services of the University of Georgia's Carl Vinson Institute. Although the new office draws much of its staff from the Vinson Institute, Senate Democrats say it creates a new level of partisanship when it comes to drawing new congressional and legislative maps.
I will be the first to say that in the past, Democrats have overreached, but not to the extent that we actually literally place the Democratic lawyer on board as an advisor and an integral part of the process. Now, since last session, I serve on the Legislative Services Committee. Since last session, I have raised at each meeting of that committee the question of when were we going to contract with the University of Georgia. And on each occasion, I got a little mumble and jumble and slipping and sliding response until we come to December. And that was a decision made that clearly was bifurcating the process, that we were moving in a direction that was going to change the order of business and the process by which we had done this for several years.
We were not consulted, our party leadership was not consulted concerning these changes of removing the work from the Carl Vinson Institute, which has been a nonpartisan institute that has done this for many years here in Georgia. We're also particularly concerned about the partisan nature of this new office that's been created under the General Assembly. And to that point, our concern particularly is the fact that it may be staffed by Republican attorneys.
In their letter, Senate Democrats asked for the establishment of a separate reapportionment office, and they give House and Senate leaders until Thursday to decide whether to comply. In other news, Senate Majority Leader Chip Rogers dispelled rumors that the Senate would vote this week on a measure to clear the way for Sunday retail alcohol sales, saying that the Senate Republican caucus has not yet discussed Senate Bill 10. Senator Vincent Fort went to the well this afternoon to serve notice that there is opposition to the bill.
Some people who stereotype African American legislators and tell us that we don't have any politics worth observing when we make considerations on this floor, that all we need is a donut and a cup of coffee and we'll be happy and vote whatever way they want us to vote. Well, I saw a little poll a couple of weeks ago that said that the only demographic in the state who's against alcohol sales on Sundays are African Americans by a margin of 53 to 40%. So I'm here to say to those people who take certain legislators for granted, you're in trouble, because you may take us for granted, but I'm going to tell it. So that's why I'm looking forward. I hope the bill doesn't come to the floor, but if it does come to the floor, we're going to have an extended conversation about stereotyping and Sunday alcohol sales.
Having cleared committee last Thursday, SB 10 awaits placement on the Senate calendar. A Senate Judiciary Subcommittee heard testimony today on Senate Bill 40. That's a far-reaching immigration reform measure, which its sponsor says is not aimed at penalizing Georgia businesses.
It's my job as a state senator to look at what's best for the state of Georgia. And that's what I'm trying to look at. It's what is best for this state. And we need to get illegal aliens, and track our illegal aliens, find out if they're being employed or not employed, and to stop that employment in the state of Georgia. And we feel like that is the intent. I feel like that is the intent of the legislation.
Although the Murphy legislation allows farmers to legally hire foreign workers by using the federal H-2A visa program, the agricultural industry representative testified that the costs are too high for many farmers.
Now, where the determinant is whether someone can use that is whether or not they can afford to do it. The H-2A program has established a minimum wage of $9.11. And it also requires, and I'll be happy to get this to you, it also requires that you provide transportation and housing for those workers during the time that they're on your farm. And the farmers that use that, and there's about 20 farms in the state, they will tell you that it ends up being about $13.50 per hour is what you end up paying for that labor. So if you're operating on a pretty tight margin anyway in the agricultural industry, whether or not you can provide that is the question of whether or not the workers may be there, sure. And the federal government may be able to provide those workers, but can you afford those workers?
This morning, I asked the state's agricultural commissioner, Gary Black, for his views on the immigration legislation. He said those bills are not under his jurisdiction, but he does favor federal immigration reform over the reform at the state level. Primetime Lawmakers will bring you that complete interview on our broadcast on Wednesday. And finally, one day after the commemoration of what would have been the 100th birthday of President Ronald Reagan, Representative Bill Hembry provided an account of his personal interaction with the president. It all began when the Douglas County High School senior wrangled his way to the floor of the Omni during a presidential visit.
And I said, Mr. President, what can I do for America? And President Reagan looked at me with that smile, those blue eyes, and he said, son, be a public servant. Be a public servant and never, never forget that you live in the greatest nation on earth. And I said, thank you, sir. And I stand here today because of that call from Ronald Reagan. Ronald Reagan will always be remembered by many of us for those great things A year later, I was invited to the White House, where I got a chance to meet him again for International Youth Year. And I was given this picture. This picture is a picture that the White House photographer took that day of me, the 17-year-old kid from Douglas County, and the President of the United States.
Meeting that had a lot of impact. Reporting live from the Capitol, I'm Wandi Lawson for Primetime Lawmakers.
Wandi, before you go, let's go back to that Medicaid ID bill you mentioned. We've heard mentions of massive fraud. Just how widespread are the incidents of Medicaid fraud here?
Well, in today's press conference, the sponsors of the legislation said that some estimates say that over 10% of Medicaid claims are in fact fraudulent. And they say this could be anything from patients passing cards between one another to doctors billing for services that they don't perform. They also said that last year prosecutors recovered about $26 million from cases of fraud.
So this initiative would more than pay for itself if they put it into play.
That's what they say.
How about that? Thanks so much for that report this evening. The highest percentage of state money may go to fund education, but House Democrats say it's not enough to meet the needs of Georgia students. In tonight's leadership segment, Wandi Lawson sits down with House Minority Whip Carolyn Hughley.
The budget as it is currently being presented does not allow for the growth in enrollment that we're seeing in our colleges and in our technical schools. And that's something that I'm sure everyone is concerned about. And of course, we're not writing the budget, and so that is not something that's necessarily in our purview. But even in lean times, we must continue to invest in our citizens and in our educational institutions, and that's our position on that, and that's what we would like to see us do. Because if we're going to come out on the other side of the recessionary times that we are seeing, we have to have people who are trained. We have to have a workforce that is ready to go in order to help attract the companies that we want to see come to our state.
So the Hope Scholarship is actually in danger of having to cut some of the benefits it provides to students. I'm wondering how you can see that program being revised, and are Democrats at the table in terms of discussing some of the ways that the Hope Scholarship can be saved?
We're working on looking at solutions to Hope. The governor sent his floor leader to our caucus meeting this morning and to let us know that he's interested in our ideas. And I think that we have to come up with ideas for Hope. We have to go back to the beginning to think about why was Hope started to begin with. We have to look at our state and what has happened in our HOPE programs during the course of the intervening years. And then we have to come up with a way to maximize the investment in HOPE so that all of our citizens can participate and that we get students off to a very good start. That's why we started the pre-K program. And if we go back on that, then it's going to be tragic in terms of the outcomes we're going to see for our children, because we're not where we need to be in education. So I can't see us going back on the pre-K program. In terms of technical schools, dislocated workers and people who need to have specific skills need those technical schools in order to support our economic engine. So we have to be concerned about that. And higher education also is very important, and it is the escalator to upward mobility. So I think what we have to do is go back to what the governor said, and that is the state should not do for you what you can do for yourself. And so we need to look at how many of our citizens can indeed afford to send their own kids to college, and how can we best help those who need the additional assistance that will make the difference in terms of whether or not those students get to college.
So House Democrats have begun unveiling their legislative agenda, and among those items is a tax amnesty program to allow those who owe the state money to pay those back taxes. How do you see that as being able to impact the state economy?
Well, the whole idea behind the tax amnesty bill is so that we can collect what's owed to the state without any penalizing anybody. And when we did that before in the early 90s, the state got in over $51 million. So the first thing, we need to collect what is owed to the state as we're looking for options and additional resources. And so we think that that may help us as well. Other states have done similar things, and they have been very successful in those states. And so we feel that that is an opportunity for us to bring in additional resources to meet our challenges. the other bill that we introduced has to do with the Public Service Commission. And the Public Service Commission affects, of course, the rates for energy that is important to every homeowner and every citizen in the state. And so we feel that the Public Service Commission needs to be more representative. It needs to have more local control. It needs to be more responsive to people all throughout the state. And because these members run statewide and we have only 5 districts, we're not as close to the needs of the people as it could be or as it should be. So that's why we're recommending expansion of that Public Service Commission, because it affects every citizen on basic things. And of course, in a tough winter like we're having now, it becomes even more important that we have a PSC looking out for the best interests of our citizens and how much it's going to cost them to keep their homes warm.
Is that done by creating more memberships on the PSC, or exactly how does the local control enter into that?
The local control is expanding out the districts from 5 to 7. And which will get the members closer to the people that they represent. Ideally, you would have members from each congressional district, so that it will be even more close to where people live, and so they'll have more direct contact with their member on the PSC. If you ask the average citizen, who's your PSC member, most would not know because they don't have that type of relationship. On the other hand, if you ask them who's their congressman, or congressperson, they indeed would know who that is.
I wanted to ask you about some legislation that you're actually sponsoring, House Resolution 72, which would allow those who had been convicted of felonies to get back on the voter rolls again. Can you kind of explain how that bill works, and why did you think it was important to legislate in this way?
Well, I think it is important that once a person has paid their debt to society, that if we're going to bring people back, and the corrections and pardon and parole have this big initiative on bringing people home, bringing them back into full participation in our society. And that's the basic tenet of being a citizen, having the right to vote. And so once they have paid their debts and done all the things that we require them to do, they should be restored and they should be brought back in. We want them to have jobs. We want them to take care of their families. We should also want them to be voters as well.
Representative Carol Hughley of Columbus is the minority whip of the House of Representatives. There's more to come tonight on Primetime Lawmakers. After this short break, I'll be joined by Representative Mary Margaret Oliver, sponsor of a child welfare bill, and Kristen Widner of Barton Child Law and Policy Center. Child welfare, specifically psychotropic drugs for foster children, is the topic, so stay with us. Welcome back to Primetime Lawmakers. Now we turn to our child welfare discussion. The state of Georgia has tens of thousands of children in its care, and a Georgia Supreme Court analysis recently found that children in the custody of the state are prescribed psychotropic drugs at a rate much higher than average. Psychotropic drugs are drugs used in the treatment of psychiatric illnesses. Representative Mary Margaret Oliver of Decatur has authored a bill, HB 23, that will require the Department of Family and Children's Services to monitor the prescription of psychotropic drugs to children in state custody. The bill is currently in committee. Representative Oliver joins us on set tonight. Also, we have Kristen Widner, Director of Policy and Advocacy at the Barton Child Law and Policy Clinic. The Barton Clinic is affiliated with Emory University. Thank you both for being here this evening. This is an important topic. I think societies are judged in the way they handle their children, the way they treat their children. You have an interesting statistic here. Children in state care are prescribed psychotropic drugs at 5 times the rate of other children.
Other children in the general Medicaid population. This is a national issue. There are a number of states, and we now in Georgia are looking at the use of psychotropic drugs for children in the foster care system. We know these children are traumatized. They're traumatized by being taken away from their family by the state. They've been traumatized by abuse and neglect. But what's good medical care? Most of these children are going to go back home. That's our policy. That's what should happen. They belong with their families where possible. But those children that are failed by the foster care system, they have multiple placements, they're not found permanently placed anywhere in any reasonable time frame, those are the children that our system may be hurting more. We know that very powerful psychotropic drugs have significant side effects, and we know from both national studies and the studies going on in Georgia that a very significant number, by my view, a significant number of children are on multiple psychotropic drugs. Is that good medical care? House Bill 23 is designed to ask that question and to ask the Department of Human Services, who's the legal custodian, children have no parents, the state is the legal custodian, to ask them to do a rulemaking process, bring folks together and create what I think might be needed is an independent medical review for children who I think fall into the red flag categories. Multiple placements, multiple psychotropic prescriptions. Not every child with a prescription needs an independent clinical review, but those children that are in most trouble, that may need the most help, I think we need to do more work.
Ms. Widner, what kind of drugs are we talking about here? What do they do?
The full range of psychotropic medications, everything from antidepressants to antipsychotics, are prescribed to this group of children. We're talking about a group of children who have had the initial trauma of abuse or neglect, followed by the disruptive trauma of being removed from their home, and then possibly multiple placements, as Representative Oliver mentioned. And so they end up having a lot of behaviors that are treated with different medications instead of sort of looking holistically at what's going on with that child. We've talked to children who have been through the foster care system who will say things like, they gave me antidepressants because I was crying every day. I was crying every day because I missed my mom.
Yeah, how about that? So who decides which kids get these drugs to begin with?
That's a great question because different states handle it differently. I think in Georgia the default rule of the Department of Human Services, DFACS, is that the individual caseworker makes the final authority, gives the final authority. Does the child have a right to know? In some states, the parent who's not the legal custodian but still has some rights for medical care oversight. If the caseworker changes frequently as the child's placement changes, where's the medical record for this child? And where is the one loving, consistent parent or authority figure through this child's trauma that's making a consistent and comprehensive decision about good medical care, including the appropriate prescription care?
That's my next point. I mean, these are prescription medications. There's a doctor involved somewhere, right?
How many different doctors, how many different placements, and do they all know what has been prescribed historically for what diagnosis, for what particular treatment?
Now, what specifically would your bill do to address this?
It asks Department of Human Services, the legal custodian, to create an independent clinical review of certain red flag cases. Not every child, not every prescription. But I think that the rulemaking process is a good technique for stakeholders, doctors, private physicians, private placement holders, to come forward and say what is needed in Georgia. Other states have a variety of ways that they assure that good medical care is being provided, and I want Georgia to have a system.
Will limiting psychotropic drugs take some parents out of the foster care system, Ms. Widner, because they say, I can't control this child any other way, and if they're not getting these drugs, I can't handle this?
Well, I think the goal is not to limit drugs that are valid and appropriate for those children. And remember that we're not talking about children who are in their parents' custody. This bill would only address those children who are in the custody of the Department of Human Services. And so it wouldn't affect independent parents' decisions about their own children. Instead, it will require those who provide substitute care for children, either in group homes or in foster homes, to receive perhaps additional training on how to handle those behaviors in other ways. It will also require them to really think consciously about whether or not the behavior that they're exhibiting is one that is medical in nature, or if it's really an outgrowth of the circumstance that the child has found him or herself in.
Are drugs a less expensive way out for dealing with troubled children? And by that I mean, therapy is expensive. Play therapy, is very expensive.
There's some evidence that that has influenced some of these decisions. The Medicaid population tends to be on prescription psychotropic medications at about twice the rate of private insurance and much less likely to receive other types of therapies. And part of that is a cost analysis and a managed care question. But I think that the issue goes a little further than that, because good therapeutic services can be had for reasonable costs. I think it has more to do with having that medical home that Representative Oliver was talking about, one consistent person or small group of people who are overseeing the overall care for that child, and really making decisions that look at all aspects of the child's life, not just one behavior at a time.
Isn't it interesting that this seems to happen on both ends of life? By the time you get to be elderly, at times you'll have 5 or 6 different doctors who aren't talking to each other, and they're giving you drugs to counteract the drugs you're taking. Another issue, while we've got you both here, it certainly applies to both of you. Juvenile code reform. Is that stirring in the General Assembly now?
It's stirring, it's moving forward. There's a high quality effort that's been carried forward by the Younger Lawyers section of the State Bar. The State Bar serves Georgia frequently to do long-term studies of code reform, modernize our codes, and the juvenile court code process has been excellent. We thank the Younger Lawyers of Georgia for their work on that. It's been introduced this year. We are really hoping for a good discussion and passage, at least in one of the bodies this year.
Does decriminalizing child prostitution for children fall into that category?
Excellent question, because we have found another bill introduced today, probably House Bill 200, that will address that specific issue. So we have lots of other issues that will be coming for the General Assembly on behalf of children. Decriminalizing prostitution, assisting children who are pimped, who are victimized by trafficking of children for sexual commercial purposes, and the Juvenile Code Rewrite Project. All of that is something we'll be working on this session.
What kind of stake does the Barton Center have in all this?
We are one of the partners in a coalition effort called Just Georgia, and Just Georgia has been working with Senator Bill Hamrick on the development of the Juvenile Code Rewrite Bill and in building stakeholder support and working out compromises within different stakeholders within the juvenile court population, both in terms of people who work in juvenile courts but also families who are served by juvenile courts.
And finally, about the half a minute we have left, there actually is little good news to talk about. There are fewer foster children now, right?
I think that's great news. We used to have, as little as 5 or 6 years ago, about 14,000 children in care. Today we have about 7,500.
Why is that?
This is a national trend. It's best practices that children remain at home. If we can support a child safely in their home, that child is less traumatized, the family is helped more than bringing a child into foster care. It's a supported best practices practice. The hard part, the critical part, is can children be safe in their home? And there are folks that argue that we're not being careful enough about the safety in home. And we're looking at that data, and it looks positive. It looks like that children can be safely kept at home, because the reality is most children brought into foster care are returned home, which is where they should be.
We'll have to leave it there, and that is a good way to leave it. Thank you so much for both of you joining us this evening. We appreciate you bringing us up to date on this critical issue. The General Assembly is not in session tomorrow, so Primetime Lawmakers will not be seen at 7, but tune in for Primetime Politics. Instead, tomorrow's program features a discussion on K-12 education. Primetime Politics tomorrow night at 7 on GPB. When Primetime Lawmakers returns Wednesday, we'll bring you another installment in our leadership interview series. Commissioner of Agriculture Gary Black is scheduled to appear, plus in-depth analysis on important legislative issues and the latest Capitol news. Primetime Lawmakers returns Wednesday, February 9th at 7 p.m. If you'd like to see a repeat of this broadcast, catch it tomorrow morning at 5:30 here on GPB. Coming up next, join David, Kat, and Ricky for Georgia Traveler, Treasures Untold, right here.
This is a GPB original production.